Well, remember this. Now this.
Thank you very, very much. Wow, what a great reception. What a great crowd. And I bet they can hear this cheering all the way in Washington, D.C.
Which is Minnesota Governor Tim Pawlenty wondering what we'll be watching a year from now after all of this. Governor, good to have you. Thanks for coming.
Great to be with you, Neil. Thanks for having me.
Well, if we've learned anything, Governor, I guess it's that times could change and issues change fast and fates and fortunes change even faster. What do Republicans do now?
Well, first of all, I think the Republicans should celebrate this victory, that Senator-elect Brown, but we should also make sure that we understand this is about the country pushing away from Democrats reacting negatively to what President Obama and this Congress and the congressional leadership of Speaker Pelosi and Majority Leader Reid have offered up. It's a rejection of that approach, an ejection of that extremism from the left. But it's also a Republican opportunity now to step in and say, hey, look, the country may not be swinging back to be Republicans automatically, but we at least have an opportunity to present our case as to why we deserve the responsibility and the opportunity to govern and lead again. And that's why we have to be more than just opposing. Now is a good time to start laying out an affirmative and positive vision for the country, starting with health care.
You know, it's interesting, Governor, because when the Senator-elect was making his comments this morning, sort of the day after, he was not saying I'm against health care reform. He clearly was saying I'm against what they were talking about in Washington for health care reform. But, of course, he was an early signee onto Mitt Romney's health care reform that covers 98% of Massachusetts residents. And despite some kinks and problems, he still largely supports that. What do you make of the idea that he might take that model as your not former, but your colleague, Mitt Romney, is pushing in Washington?
Well, speaking for myself, Neil, we have to all acknowledge, Republicans, Democrats, independents, and others, that the current health care system is broken. The main reason it's broken is because it's not affordable for too many Americans. It's not sufficiently affordable. The Democrats have said we're going to just expand access to a broken system. That's not reform. So in my experience, Neil, the way to control costs is not to have government-run stuff. It's to make sure that consumers are in charge, give them good information about price and quality, and then give them financial incentives to use the system wisely.
Yeah, but we have a lot of, in the case of Massachusetts, we have a lot of state-run stuff. Now, I guess the devil's in the details and who's calling the shots, but a state plan, a government plan, it's still a big plan, right? So what's the blueprint?
Well, I think the blueprint is this. I won't go through it all because I know people's eyes glaze over when you talk about health care reform. But let's do medical malpractice reform. We should be able to agree on that. Let's have some reasonable prohibitions on pre-existing conditions. Let's start paying for performance rather than paying for volumes of procedures. Let's make sure that we get good information and empower consumers, not the government, within a marketplace. And if people need a little help in buying insurance, then we can give them tax credits to do that. We don't need to have a government-run program. So those are some of the features that I think we could agree upon. And if need be, you can pass them as single bills, so you don't have to have a big Christmas tree bill. But I hope Republicans will step forward and now and say, let's also offer up some solutions.
All right, Governor, thank you very much.
Hey, you're welcome, Neil. Thank you.
Well, the title of the